Assalamu alaikum. How are you, Abira? Okay, good. So let us start our class. Alhamdulillah, I'm fine too. All right. So today is lecture number 5 of your subject health and safety in health and social care workplace. So in today's class, we will be studying assessment criteria number 2.1, learning outcome number 2. One that is understand the ways in which health and safety requirements impact on customers and the work of practitioners in the health and social care workplace. So today we are going to study the assessment criteria number 1, that is analyze 2.1, analyze how information from risk assessments informs care planning for individuals and organizational decision. So it is basically the extension of learning outcome number 1. In that part, we also studied about, in the last part of learning outcome number 1, we also studied about the risk assessments over there, and now we are continuing the same topic. While we will study the detail related to the work of practitioner and the requirements impact on customers in upcoming assessment criteria. So objectives of today's class is to understand the risk assessment in health and safety care workplace. Now, what is the concept of risk assessment? Requirements for risk assessment: identifying the potential hazards and risks, for example, infection, fires, trips and falls, food risks, and etc. Identifying who might be harmed and how, implement and monitor controls, record risk assessment, review, and update. So, we have studied the first 2 points in the previous lecture, and now we will be continuing the third point, that is identifying who might be harmed and how. So, third point, identifying who might be harmed and how. Let us have a look at this point. As part of risk assessment, it is important to identify who might be harmed by the potential hazards or risks, as well as how they may be affected. This helps to ensure the appropriate measures are taken to prevent harm and protect the health and safety of individuals. So, it is very vital to know about a certain risk or certain hurdle, and along with the nature of the risk, it is also very important, or you can say mandatory, to know that with the presence of this risk, who will be affected and to which extent he will be affected. Whether the patient will get affected by the risk present in the workplace, or it will be the physician or any other visitor or anyone from the administration department. Of course, the one who will get affected is actually the one who is in direct exposure to that risk or that risk area. So, here are some examples of how to identify who might be harmed and how. First is infection. In case of infection, infection is a risk, okay? So, in case of infection, infection can harm the individuals who are immunocompromised, have chronic medical conditions, or who are recovering from surgery. Healthcare workers and visitors may also be at risk of contracting infections. Okay, so by the occurrence of infection, the individuals who are at prime risk of getting infected or getting harmed are basically the patients themselves, and specifically the immunocompromised patients, or you can say the chronic patients who are suffering from any ailment from a long duration, or who are at the later or the more crucial stages of that disease. Now, healthcare workers, including the physicians and the nurses and the visitors, they are also at the risk, but of course, the individuals who are at a much higher state of risk are the patients. Then comes second risk is fire. Fire can harm anyone who is present in the building or location where the fire occurs, including the individuals with mobility impairments who may have difficulty evacuating. Okay, so fire is another risk, and fire can harm any person who is present in the building at that moment, or who is present in specifically at that location. Okay, so that individual or that person can be anyone, any visitor, any patient, any person from healthcare department. And by the occurrence of fire, the person who have mobility impairment, the individuals who have the mobility impairments, they are at the prime risk of getting affected by fire, because they'll not be able to save themselves from the disaster caused by the fire, and due to this they will be affected badly. Trips and falls. Trips and falls can harm anyone who is present in the environment, but may be more likely to affect older adults and individuals with mobility impairments, or the individuals who are visually impaired. Okay, so trips is another risk present in social care workplace. And by the occurrence of trips and falls, usually those persons get affected that have mobility impairment again. Why? Because they are unable to walk properly. And in case if they fell down as a result of any accident, they will be unable to become stable again. And the second ones are those who are blind, who have visual impairment. For example, if no one is present for their sport or to guide them, of course, once they will fall down, it will be difficult or rather impossible for such patients to again get up. Then comes the food risks. Okay, food risks harm the individuals who have food allergies or sensitivities, as well as the individuals who will be more vulnerable to foodborne illnesses, such as pregnant women or the individuals with a weakened immune systems. Okay, so food risks, of course, food risks occur, or they are more bad for those individuals who are having specific allergies or specific hypersensitivity or sensitivity reactions as compared to the specific food ingredients. For example, some people suffer from milk allergy. They are unable, because their gut is unable to digest the milk properly. Okay, their normal flora, the normal flora of the gut is basically disturbed, and they are unable to digest the milk, the protein portion actually. Sorry, the iron portion actually. Then comes the medication errors. Medication errors can harm the individuals who receive incorrect doses of medication, or who are prescribed medications that interact with other medications they are taking. So, of course, as the name indicates, medication errors basically occur in patients because they are the one who are taking the medications, either orally or intravenously or intramuscularly. So, medication errors always happen when a person is allergic to any specific ingredient of the medicine, or if the person is taking more than two medicines and both medicines have the power to interact with each other to show the side effects or drug interaction. So these are some examples of the basic risks that can occur in any health and safety care workplace. And in this part, we have also discussed that who individuals or who persons are basically at verge of getting affected by these risks. By identifying who might be harmed and how, care providers and organizations can take steps to prevent the harm and protect the health and safety of the individuals. For example, measures may include implementing the infection control practices, providing the fire safety training and evacuation plans, improving the environmental design and accessibility, implementing the food safety protocols, and ensuring that medication management practices are standardized and effective. So, these are basically the basic steps that should be taken by the organizations or by the administration department of that organization, the health and social care or safety care organizations. So, such occurrence of these risks can be avoided. Proper measures should be taken by the organization. Proper training should be arranged for the individuals or for the persons from health and safety care area or administration area as well. So if they will be properly trained, so of course there will be minimum chances of occurrence of any risk. Okay, so this was all about the first part, that is identifying who might be harmed and how. Now comes the fourth point, that is implement and monitor controls. Okay, so after knowing well that which persons are at the verge of getting affected by certain type of risk, the next step comes, that is implementations and monitoring of the controls. Okay, so after identifying the potential hazards and risks and who might be harmed, the next step in the risk assessment process is to implement and monitor the controls to mitigate or eliminate these risks. Here are some steps to implement and monitor the controls. Determine the most effective control measures. Depending on the nature and severity of the identified risks, various control measures can be implemented to mitigate or eliminate them. For example, if the risk is related to infection, control measures such as providing training on proper hand hygiene, wearing personal protective equipment (PPE), and implementing the isolation precautions may be effective. Okay, so first point is determine the most effective control measures. When a certain hazard or risk has been identified, now we need to implement and monitor the controls. For example, in case of infection, what kind of control measures could be taken? Proper training should be provided to the individuals who are directly involved in taking care of the individuals, patients basically. They should be trained enough for maintaining the proper hand hygiene. They should be trained enough to wear the PPE, personal protective equipment, while they are visiting the patients, and implement the isolation precautions. Okay. So, what are the isolation precautions? That the patients who are having a certain kind of infection, contagious infections, they should be kept isolated from rest of the patients. There should be either a there should be a separate ward for those patients, or there should be separate personal room for such kind of patients who are suffering from some contagious infection, because there are chances of spreading of infection, so of course they should be kept in isolation. Next is implement control measures. Once the most effective control measures have been determined, they should be implemented in a timely and efficient manner. This may involve providing the training and education to the staff members, updating policies and procedures, or making physical changes to the environment. So it is basically a step-by-step process. So first step is to determine that which kind of control measure should be implemented. The second step is to physically, or you can say technically, implement the control measure. For example, in first part, if we have identified that training of the individuals or the training of the staff is very necessary, so in second step or second part, we will basically implement that thing. We will start the training of the individual in a timely and the time efficient manner. Then comes monitor and evaluate the control measures. So after the implementation of the control measures, of course, we need to monitor and evaluate the efficacy of that control measure specifically. It is important to monitor and evaluate the effectiveness of the implemented control measures to ensure they are reducing the identified risks. This may involve tracking and reporting incidents, conducting audits, or regularly reviewing the policies and procedures. Okay, so now we are basically monitoring the control measure. We are basically analyzing that whether our training programs have been taken as such by the individuals or not. Are they following the rules and regulations in implementing certain policies or not? Okay, so we will basically audit the control measure that have been implemented, I mean the training. We will analyze it, we will review, and we will keep a proper supervision, or you can say an observation over the staff, whether they are working properly according to their training or not. Adjust the control measures as necessary. If the implemented control measures are found to be ineffective or insufficient, Adjustment should be made to improve them. This may involve updating their policies and procedures and providing additional training or making the physical changes to the environment. Okay, so if the implemented control measures they are found ineffective, for example, we have trained our staff and now we have analyzed that that training was not sufficient enough for the proper or efficient working of the individuals. Now we will do the adjustments. We will start the career courses, we will start the short courses or short trainings again in order to improve their efficiency. We will change our policies, we will change our procedures, we will change, basically we will change uh, the working process completely in order to make them more efficient. Continually review and update controls. Risks can change over time, so it is important to continually review and update the control measures as necessary to ensure they remain effective. Okay, so after we have analyzed our control measure, we have adjusted the control measure after analysis, we will again start to review the control measure. And this system of reviewing and updating, it will carry on throughout the procedure, throughout the duration, you can say. Why? Because the severity of the risks can change along with the passage of time. The nature of the risks can change with the passage of time. So it is better to review, to keep on reviewing and updating the controls depending upon the circumstances. Risks can change over the time, so it is important to continually review. So after we have reviewed our monitored and analyzed our control measure, we have adjusted the control measure if required, and after the adjustment we will again review our control measure. So after adjusting the control measure we will again review our control measure, and this reviewing and upgradation or updating of the control measure will be continued for the complete duration, because the nature of the risk can be changed with the passage of time, the severity of the risk will change with the passage of time. So occurrence of the risk depend upon the circumstances, and due to this, the review and update programs. This is a continuous process. Okay. Implementing and monitoring the controls. Last one is implementation and monitoring control finally as a critical step. So implementing and monitoring control is a critical step in the risk assessment process to ensure the safety and well-being of the individuals and prevent the adverse events. By continually monitoring and adjusting the controls, care providers and organizations can mitigate the risks and ensure the best possible outcomes for the individuals they serve. Okay, so why it is very critical step or why it is a very important step, implementation and monitoring of control, because again the same thing, circumstances are changing with the passage of time, the nature of the risk is changing, so it is quite important to keep on analyzing, to keep on changing, to keep on reviewing your um, monitoring controls or basically the steps that have been taken in order to train the staff. Okay, so last one is record the risk assessment and review update. Recording the results of risk assessment is an record risk assessment and review and update. So after we have implemented the control measure, now we are going to record the risk assessment, review and update. Okay, so now we have to record that what steps have been taken for the risk assessment and how the review is going, how the update control measure is going. Recording the results of risk assessment is an essential part of the risk assessment process, as it helps to document the identified risks, the control measures that have been implemented, and the ongoing monitoring and evaluation of these controls. Okay, so here are some important steps to record a risk assessment. Why it is important to keep a record of risk assessment? Of course, it is quite important for the future as related to the proper working of certain equipments for the proper working or proper dealing with the specific individuals, patients, specifically the chronic patients. So it is very important to keep the record of every kind of risk assessment. And document the risk assessment process. Number one, record the steps taken during the risk assessment process, including the hazards and risks identified, who might be harmed, the control measures considered, and the decisions made regarding the most effective control measures to implement. Okay, so it is important to keep the risk assessment documented. It involves every step that has been taken in order to assess the risk, in order to assess the risk related to the hazards and the risks identified, and the individuals or the patients who might be harmed or might get harmed as a result of this risk. Next is document the control measures. Record the control measures that have been implemented to mitigate or eliminate the identified risks, including any policies and procedures that have been updated, any physical changes that have been made to the environment, and any training and education provided to the staff members. Okay, so first point was to document the risk assessment process, what steps have been taken, and the second one is to document the control measures, which control measures have been adopted in order to mitigate the risk. Okay, it involves any physical changes if required, for example, installation of air conditioners in the wards if required, if the patients are, for example, if they are high BP patients and there is no air conditioner present in the ward, and that will of course deteriorate the condition of the patient or make the condition of the patient very worse. So then it becomes very important to install any AC. So these are some example of physical changes that should be made in that ward, or in order to, you can say, implementation of the control measure. Please document the ongoing monitoring and evaluation. Because we have implemented the control measure, so next step is of course the documentation of the monitoring, the evaluation, analysis, or you can say the review. Record the ongoing monitoring, and it is very important to document the uh, review systems or the monitoring process or the analysis part of the risk assessment. Record the ongoing monitoring and evaluation of the implemented control measures, including any incidents or near misses that have occurred, any audits conducted, and any changes made to the control measures as a result of these evaluations. Okay, so during our review or analysis, if we have done any audit or we have done any survey, all of these things should be documented. Then comes ensure accessibility and accuracy of records. Ensure that the records are easily accessible to the staff members and the stakeholders who need to review them, and that they are accurate and up to date. Okay, so the records should be accurate enough and should be accessible to the staff members or the stakeholders. Why it should be the record should be accessible to the stakeholders? Because they are the one who are basically funding that organization. So it is very important for them to keep in touch with the upgradation program of the organization. So the record should be up to date and accessible. This may involve using a digital platform to store and access records, or implementing a system for regularly reviewing and updating records. Okay, so in order to keep the record updated or up to date, it is very important that, in spite of keeping the record manually in some kind of registers or some kind of papers, it is important to keep the record on some digital platform. Okay, so that it can be easily accessible for any member from the stakeholders or any member from the staff. Review and update records regularly. So not only once the record has been uploaded on any digital platform, it doesn't mean that it should remain as such. It should be updated regularly, accordingly. For example, if there certain changes have been made in the control measures, all these things will be documented on the platform. So basically, Regularly review and update of the risk assessment records should be done in order to ensure that they reflect the most current hazards and risks as well as any changes to the control measures or monitoring and evaluation process. Okay. Recording risk assessment is critical for ensuring that risks are effectively mitigated and there is clear and transparent record of the actions taken to promote the safety and well-being. By documenting the risk assessment process and the ongoing monitoring and evaluation of control measure, care providers and the organizations can ensure that risks are effectively managed and that they are providing the best possible care to the individuals they serve. Okay, so why here it is summarized, the aim of risk assessment or recording the risk assessment. It is very crucial. Why it is very crucial? Because, for example, in future, a risk has occurred and the staff has been changed. 80% of the staff has been changed. So how can we get to know that what steps have been taken in the past when this risk occurred? Okay, so it is important to keep the risk assessment documented. It become very easy for the new staff or the upcoming staff to take the preventive measures or the important precautions in order to mitigate that risk. Okay, so next is the risk assessment and the care planning. It involves the three steps basically. Number one is assessing the risks for individuals, meeting health and safety needs, and acceptable risk or risk benefit analysis. So let's have a look on them one by one. So let's understand what is basically the care planning in relation to the risk assessment. Risk assessment and care planning are important processes in healthcare that aim to identify the potential risks to patients and develop plans to manage those risks. So, care planning is something that is related to the risk assessment in terms of identification of the potential risks and development of the plans in order to manage those risks. Risk assessments involve evaluating a patient's medical history, current current health status, and environmental factors to identify any potential risk or vulnerabilities. So, care planning and risk assessment, it means that it is related with the risk that are directly affecting the patient. Such kind of risks are directly affecting the patients instead of some visitor or any member from the staff. This include the risks related to falls, infections, medication errors, and many other health related issues. Care planning involves developing a comprehensive plan to address the identified risks and provide the appropriate care and support to the patient. So, of course, once the risk has been occurred and it has been identified, so now although the steps have been taken in order to mitigate the risk, but care planning involves directly the appropriate care, the proper care, and the support of the patient. This can involve the coordinating with the healthcare providers, developing the treatment plans, and identifying the strategies to help out the patient manage their health conditions. Okay, so in addition to the management of risk, the care planning involves the coordination of healthcare providers with the patient, development of proper treatment regimes, and identifying the strategies to help the patient manage their health condition. Effective risk assessment and care planning can help prevent the adverse events and improve the patient outcomes. It is important for healthcare providers to regularly review and update these processes to ensure that patients receive the best possible care. So, of course, it involves the training of physicians or the healthcare providers so that it should be ensured that proper care or proper provision of the treatment has been given to the patients. Okay, so now the first part of the care planning involves assessing risks for individuals. Assessing risks for individual involves evaluating the potential risk or vulnerabilities that a specific person may face based on their medical history, current health status, and the environmental factors. The process of assessing the risk for individuals. typically involves gathering information about the person's health and lifestyle, as well as any relevant family history or other medical factors that may impact their health. So, assessing the risks for individuals, it means that up till now, none of the risks has been occurred, and we have to take the medical history of the patient. We need to know what kind of allergies he is suffering from, and what are the potential risks that the person, the inpatient, can suffer from hypersensitivity reactions or the allergies in future, so that we will devise the medication plan or the treatment plan accordingly. We will provide all the optimum facilities to the individual, to the patient. This can include conducting physical exams, reviewing medical records and test results, and gathering information about the person's living environment, diet, and exercise habits. So, we will actually gather all such kind of information: his habits, his diet, his allergies, his hypersensitivity reactions, medical history. We'll conduct important tests and important physical exams as well, so that we should know each and everything about the patient, and we will manage accordingly. The risks can be avoided in this way. Once this information has been gathered, healthcare providers can use various tools and guidelines to help identify potential risks and develop appropriate care plans. These may include screening tools and assessments that are specific to certain health conditions or risk factors such as falls, cognitive impairments, or medication use. Okay, so once all the tests have been done, all the physical examinations have been done, the medical history has been taken. Now, the second step is to identify what kind of potential risks the patient can suffer from. Okay, so now this step involves some screening tools and some other further assessment tests that are very important to the specific health condition with which he is admitted in that hospital. Effective risk assessment for individuals involve taking a holistic approach to evaluate a person's health and lifestyle and developing the personalized care plans that address their unique needs and vulnerabilities. This can help prevent adverse effect events and improve health outcomes for the individual. So, of course, why we are taking the medical history and we are conducting the important blood test and physical examination, because we need to customize a proper treatment plan for that patient. Okay, so the second part is the meeting health and safety needs. Meeting health and safety needs is an important aspect of healthcare that involves ensuring that patient receives the care that is safe, effective, and responsive to their individual needs. So, in this step, we are basically ensuring that what we have done in part one or level one, now we are making it sure that we have done it very well, and now we are providing customized care to after we have taken the medical history of the patient, when we have conducted the basic test, blood tests and many other tests and screening tests. In this step, in this level, we are basically ensuring that what we have done in first step, now we are implementing the things accordingly. We are providing a customized treatment plan to the patient, and that plan not only includes only the medication, but also the proper care, proper diet, proper exercise, everything. To meet health and safety needs, healthcare providers must take a comprehensive approach that includes assessing the potential risks and hazards, developing the protocols and procedures to minimize those risks, and ensuring that patients receive appropriate care and support. Okay, so this point also includes that if in case every risk has been occurred, for example, the patient is visually impaired, or he is unable to walk properly, and if he has fallen down or he has met an accident, in this case we are basically provide the optimum control measure to the patient. We are making sure that while his stay in its in our hospital or in our healthcare organization, we will make sure that the patient will not fall down or he will not be left alone in any hour of the day. Okay, so come some key strategies for meeting the health and safety needs in healthcare include conducting the regular risk assessments to identify potential hazards and risks to patients' safety. Second is developing the protocols and procedures to minimize the risks and ensure that patients receive safe and effective care. Okay, so first one is we are conducting the risk assessment regularly because sometimes the risk has been occurred but it is not identified at the proper time. So it is very important to conduct the regular risk assessment. Number second is to develop the protocols and procedures to minimize the risk. Okay, so we are going to develop some control measures or implement some control measures in condition if the risk occurs. We will ensure that occurrence of the risk will not harm the patient. The patient will keep on receiving the safe and effective care. Providing education and training to the healthcare providers to ensure that they are aware of best practices for patient safety. Of course, proper training is an important part of the continuous reviewing or analyzing risk assessment or care planning. Okay, it is very important part of care planning that all the staff members should be regularly trained or should be regularly educated enough for mitigation of the risk assessment and the care planning. Ensuring that patients have access to appropriate equipment and resources to support their health and safety needs. For example, if the person is cannot walk properly, okay, or immobilized, then he must be in excess of the wheelchairs or the caretakers all the time. Encouraging the patients to be actively involved in their own care and to report any concerns or issues they may have. The proper, or you can say the successful treatment of any patient involve the involvement of patient himself. Okay, so every patient should be should know that what kind of treatment he's getting and what is his health condition now and how his health is improving and what kind of changes he want to made in his diet or in his treatment or his medications. By taking a comprehensive approach to meeting the health and safety needs, healthcare providers can help prevent adverse events and improve the patient outcomes while also promoting a culture of safety and quality in healthcare. So, healthcare providers play a very important role not only in the risk assessment but also in the management of care planning. Okay, last part of the care planning is acceptable risk and risk benefit analysis. Accept- Acceptable care and risk benefit analysis are important concepts in healthcare that involves evaluating the potential risks and benefits of medical treatments or interventions. Okay, so it involves the evaluation of the risk and it involves the management of the risk as well and the benefits of the medical treatments or interventions. Those interventions that have been brought into the medical treatment as a result of those risks. Acceptable risk refers to the level of risk that a patient or healthcare provider is willing to accept in order to achieve a particular outcome or benefit. This can vary depending on the specific situation and the individual's preferences and values. Okay, so by acceptable risk, we mean that the level of risk patient or healthcare provider is willing to accept. Beyond that limit, beyond that level, of course, it will become vulnerable, or you can say it will not be acceptable for the patient or the healthcare provider. So at that point, it becomes very important to take some important steps or in order to mitigate that risk. Risk benefit analysis involves weighing the potential risk and benefits of a particular medical treatment or intervention in order to determine whether it is appropriate for a particular patient. This can involve evaluating factors such as the severity of the patient's condition, the potential benefits of the treatment, and the potential risks and side effects. Okay, so risk benefit analysis. It means basically analyzing that what kind of risks can happen while taking a certain medication and what kind of benefits the patient will get as a result of the medical treatment. So basically, it will be analyzed that whether the side effects are more than the benefits of the risk medication or the treatment plan, or whether the benefits are more as compared to the side effects, because there is a limit for every person to bear the risk, and beyond that limit, of course, it becomes unbearable, so the patient will not opt out for that treatment. Okay, so this risk benefit analysis or the acceptable risk analysis involves basically analyzing the treatment plan and then making the changes accordingly. Some key consideration in risk benefit analysis include the severity of the patient condition. If a patient's condition is life threatening or has significant health implications, the potential benefits of a treatment may outweigh the risk. Okay, so if a patient is a critical patient, so we will not go for that treatment who that may have some risk or some side effects as well. Okay, we will only opt out for that treatment in which the benefits are more than the risks. The potential benefit of the treatment. Healthcare providers must carefully evaluate the potential benefits of the treatment and determine whether they are significant enough to justify the potential risks or not. The potential risks and the side effects. Healthcare providers must carefully evaluate the potential risks and side effects of a treatment and determine whether they are acceptable given the potential benefits. The patient's preferences and the values. Healthcare providers must take into account the patient's preferences and values when evaluating the risk and benefits of a treatment. Okay, so in short, we will only go for that treatment that will be having minimum risks and will be affecting the patient in a positive manner. Because if the patient is critical or the patient is chronic, of course, we cannot go for the treatment that is having some side effects. By conducting a thorough risk benefit analysis and taking into account the patient preferences and values, healthcare providers can make informed decisions about the medical treatments and interventions while also minimizing the potential risks to the patient. Okay, so whenever we conduct a thorough risk benefit analysis, we must take into consideration that the healthcare providers or the physicians, they will also be informed along with the patient regarding the potential risks of any treatment plan. Okay, so beta, this was all about the risk assessment and care planning. So if you have any question up till now, please do tell me. Okay, good. Yes, please ask. So learning outcome is, of course, the learning outcome number 0.2, sorry, 2. Understand the ways in which the health and safety requirements impact on customers and the work of practitioners in the health and social care workplace. Okay, what is the concept of risk assessment? What is basically the risk assessment? Can you please define in your words? Yes, exactly. So basically, risk assessment is analyzing what sort of hurdles or the harms can occur to the people, and care planning involves the precautions or preventive measures. Okay, all right, good. Okay, take care of yourself, beta. Allah Hafiz.